shorting of breast. What you need to ask about shorting of breast.
When did it started?
It is started many, many years ago, maybe 5, 10 years ago.
Okay. How did it start? It started gradual or intermittent?
No, it is gradually.
Okay. Do you have an asthma?
Yes, I have asthma, and it take about 10 to 20 minutes. This is variable. Sometimes maybe more, sometimes be less.
Okay. Do you take any drug for it?
It is occur often once a week. No, I go to the doctor and he asks some bronchodilator, so I take it sometimes.
Okay, Mrs. Sarah. Do you have any swelling in your leg?
Swelling in my leg, no.
Okay. Do you have any difficulty when you lay down?
You mean the dyspnea when I lay down, like proximal nocturnal dyspnea or something
Yes.
like that? No.
Yes.
I sleep well, and okay. Okay. What else you need to ask?
Do you have any complications with anesthesia before?
I don't have anesthesia before.
Okay. Do you have someone else in your family has the same condition?
Yes, my father died from heart attack.
Okay. Do you have any medical condition other we discuss?
Like what?
Like problems in your gallbladder or
Yeah,
problems
I
in
have already. I have gallbladder. I came because I need to remove my gallbladder because I have chronic calcium cholecystitis.
Okay. Do you have any surgery before?
No surgery before.
Okay. Are you smoker?
Yeah, I smoke 5 cigarettes per day for the last 20 years, but I stopped for 1 month as the doctor advised me.
Okay. Are you drinking alcohol?
Yes, I drink alcohol occasionally and in weekends.
Okay. Where are you living?
I live in the city town
With whom?
with my husband.
Okay. What is your occupation?
I am teacher.
Okay. Do you have any difficulty when come upstairs?
No,
Okay, Mrs. Sophia. Do you need to add anything else?
no.
Okay, Mrs. Sophia. You come today for assessment for your operation, and I will discuss that with my senior and know if you are.
Okay, thank you.
Thank you very much. Thank you.
Okay, actually, Dr. Iman, you missed something very important. History taken is history taken apart from the scenario. Okay, so in history taken have item like history of present illness, you discuss it, but you need to ask about other system like urinary system, gastrointestinal system, the other system. You miss that. After that, social history you ask, family history ask, you past history, admission to the hospital you ask, you forget to ask about allergy. Okay.
Okay.
It is important. I show you the answer later. It is important. The main scenario is breathless. So you need to start by shorting of breath first and the proximal nocturnal dyspnea before you ask about hypertension and diabetes. What you need to tell?
Okay. So I will start with the shortness of breathing and
Because you start by the main complaint you are worried about. So I will show you. So first, after that, introduce yourself, confirm the patient name, what is the problem, history of present illness. You ask about this, and this is the item of the history. For example, how long you have breathless? 4 year, 5 year. How long it take? 10 minutes, 20 minutes. How often is occur? Once per week, twice per week. Are you sleeping well? Yes. You have proximal nocturnal dyspnea or orthopnea? No. Is attack increase after diagnosis of gallstone? Yes. Can be described the attack, shorting of breath, unable to talk, tight chest, is breath rapidly, shallow breath. You ask about this. Are you tightening numbness during attack? Yes. Numbness around my mouth. Any chest pain? Yes. If the patient has chest pain, you need to describe is radiated to the left arm. You ask about that. No. If the pain like biliary colic, no. If any epigastric pain, any difficult to swallow, any fever, nothing. After that, Are you married? Yes, I am. Wudu, 2 young children, something like that. Allergy, you don't ask about allergy. After that, we ask you about investigation. Don't forget systematic review. You ask about urinary system. You ask about diarrhea, constipation, and all this. Of course, you ask about medical, chronic illness, drug history, family history, social history. I think you ask about drug history. After that, we go to investigation. What investigation you need to do for this patient?
I need to do routine labs like CBC, renal function, kidney function, collating profile,
What is
ECG and ABG.
what is ABG?
Echo. ECG and echo.
What is ABG? You mentioned ABG. What is ABG?
Arterial blood gases.
Arterial blood. What is the type of syringe used for arterial blood gases? What it contains?
Heparinized syringe.
How long do you press on the vein in the artery after you take a sample? How many minutes or how many seconds do you press to the artery after you take a sample?
1 minute.
What? No. What is the bleeding time?
Is less
Normal
than
bleeding.
50 seconds.
No, 15 seconds is a prothrombin time. Bleeding time is 5 minutes. So you need to compress more than 5 minutes.
Okay.
Okay, so this is first. After that, I show you chest X-ray. Not necessary to be of this patient. What you see here in this chest X-ray?
Okay. It's I see that it's normal.
Normal. Can you concentrate on the right side? What is this in the middle?
I see that is the lung is collapsed and it's a pneumothorax.
Which side?
Is right side.
Right side. Okay. So you mentioned you need to do chest X-ray, and you mentioned ECG, and you mentioned echo. So what you are looking in the echo?
I look ejection fraction.
What is normal ejection fraction?
Is 55 to 65.
What is ejection fraction mean? It is what over what?
It's in the diastolic volume to in the systolic volume.
No, over stroke volume. I think over stroke volume. Okay. After that, usually the examiner will check it again. After that, the examiner asks you to draw the respiratory function test curve. You see this curve?
Yes.
Yeah, you need to know that this tidal volume, inspiratory, expiratory reserve volume, and all this is vital capacity, and after that, total lung capacity. Okay?
Okay.
All right. Well done, but what's your diagnosis? What you expected? This is dyspnea due to?
I think
forget the X-ray is not related, but what you expected?
maybe due to asthma. She has
can be asthma, can be an anxiety, but it is we don't know. But from respiratory function test, if the normal, so it is just an anxiety.
Okay.
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 All right. So what I see is again when you take a history, don't concentrate on the disease. Of course, disease is important, but you need to ask about social history, family history, history of allergy. Don't forget other disease or other system like urinary, shorting, apart from this scenario. So you need to ask about other system. What happened in exam? They usually you concentrate on the main disease and forget the other system, forget social history, allergy, family history, past history of admission, and disease about 6 marks.
Okay, doctor.
Okay?
Okay, doctor.
All right. I will send you in the group a checklist for history taking. For all history taking, no problem. We have a book for the OSCE, so we send it to you. Okay. All right. I just repeated this scenario because last time we have a problem with this scenario, so I try to make it more bigger or something like that. Okay.
Okay.
So after that we have urinary symptom. I just try to make it bigger. Okay. So it is again, it is important that don't think that each scenario have a script is like what we teach in the college. that each scenario have a script or have something. We don't have this in the Royal College. Okay. So I just try to share again. Okay. Okay, I'll start another scenario about depression. After that, we can go to this urinary, or we can start by urinary. Okay. See again. Okay. Okay, I hope this is appear. Again, in the most of the scenario in the college, you have many scripts, so it is variable. Like today, for example, I am 75 years old man, complain of urine retention, admit yesterday and insert a catheter and take a history, and examiner ask you some question. So anyone, or Iman or Dr. Muhammad, anyone?
Could I continue?
Okay, can, no problem. We have two scenarios, so you take one and the doctor shall take the second. In the same
Okay.
problem, you can start.
Okay, doctor. Hello, I'm Dr. Iman. I am one of the surgical doctor candidate. Could I confirm your name and age, please?
Yeah, I am Mr. Muhammad. I am 65 years old.
Nice to meet you, Mr. Muhammad. Today, I have been asked to ask you some question about your condition. Is that okay with you?
Yes, can, no problem.
Okay, Mr. Muhammad. How can I help you?
No, actually, I admitted yesterday I have something called urine retention, and I came to the hospital and they insert a catheter.
Okay. Why do you insert the catheter for the urine retention?
Yes,
Okay. Since when did it started?
yesterday. I was watching the TV, and I have a desire to pass urine, difficult to pass urine, so I came here.
So it is started sudden for you?
It started suddenly. I have pain.
Okay. Do you have any previous like that?
No, first time.
الو
Is there any
دكتور محمد زي
okay.
حضرتك
Do
كله
you
تمام
have
زي الفل
any
تعبينك معانا
difficult in passing urine?
ماشي
Yes.
Okay. Have you any urgency to go for the bathroom?
Yes, I have. Yes.
Okay. Have you a
طب
long time
انا
for passing
اطلع
urine?
لك الرقم اللي كلمني
Yes.
منه امبارح خليك معايا
Okay. Do you have any dribbling drops after urinating?
Sometimes.
ان شاء الله موجود
Okay.
الساعه
How
9
many
وانت
times
بعت
you
لي
go
الجي بي اس ان شاء الله
for
اكون موجود
toilet?
باذن الله
6 times.
6 times. Okay. Do you
ايوه
feel that you not completely
Yes,
empty?
sometimes I have incomplete evacuation.
الخلايا
Okay.
العسكري
Do you have a
اوكي
fever?
No fever.
لا خلاص يبقى كده
Do you have
تمام لا لا
any pain
تمام
in your
ان شاء الله يسعى
urine?
عليه طيب هشام جاد عباره عن 010
No.
Do you
2
have
8
any
6
pain
4
in your lower part in your stomach?
ايوه 1020
What you mean by lower part of the stomach? Abdomen, you mean?
اوكي
Yes.
Lower abdomen. No.
Okay.
زي الفل زي الفل
Have
ممتاز
you
زي
any
الفل
previous
هو
history
قال لي ان
of
يقدر
passing
نأجر ب 4000
stool
جنيه بتاع الاير واي الفول
Of
ست
what?
عايزين ناخد
of
صوره
passing stone?
ناخد صوره ويبقى ده
Stone,
كده
no,
وفرنا
no.
نص المشكله
No. Okay.
بس
Do you have any pain during urination?
Yes, I have pain. You ask, and actually I have pain during the urination.
Okay. Do you notice
لا
any swelling
لا
in your back?
لا لا لازم عن طريق الاكاديميه
What you mean by
السكرتاريه ليه هم
what you mean?
بيتعاملوا
In your
شويه فيها
vertebrae.
صعوبه يعني لكن
I sometimes
لازم عن طريق
no.
السكرتاري ما هماش
Okay. Do you have
ما
any
هماش
problem in
شيء
your
Why you
لا
ask this question?
ولو ان انا اعتقد
You
مستبعد
can ask
الاكاديميه
later.
تقول
No
لك حاجه
problem.
بره
No
الجيش
problem. Okay.
خدوها اجروها
Do you
رجعوها
have
لنا
any
ان الفلوس ما
any
تفرقش
problem
معاهم
in
خالص
your
بس
sexual
نتيجه
activity
علاقات
like
شيرين
ejaculation
الخليلي
or erection?
لانه اشتغل في الاكاديميه فتره سنين
Okay. Do you have any
فيبدو
weight
هيعملوها
loss?
خدمه لشيرين مش لحاجه
No weight
تانية
loss.
any loss of appetite.
انا بحاول اتكلم النهارده عربي هو برنت فعلا بس تقريبا
سانسور.
any
طيب ابعت
okay.
لشيرين، شيرين قول له انا
any
بحاول
awareness
خط
of your
الارضي،
heartbeat,
انا موجود على ويبينار
No.
لشيرين
any
دلوقتي
chest
بنعمل
pain,
اوسكي ستيشن،
No.
فابعت له على
any
الموبايل ولا
constipation
عنده
or
10
diarrhea,
مثال، قول له انا
No.
بحاول
any
الرقم ده ما
joint
حدش
pain or
بيرد، هل
muscle
في
pain.
حاجه عشان احجز معاك
No.
بكره ااكده
Do you
الساعه
have
10
any
صباحا.
medical condition
خلاص
other
اوكي،
than
شكرا يا حبيبي، كتر خيرك،
like
مجهود
hypertension or
رائع، وان شاء
diabetes
الله
or
بعد كده
asthma
المرات الجايه تبقى
No.
اسهل باذن الله.
ان شاء الله هجيلك في
done any
الله
previous
يخليك، شكرا
surgery?
دكتور محمد،
No.
كتر خير، مع
Do you
سلامتك.
taking any drug
مع
for
السلامه.
any condition?
Say again.
Do you taking any drug for any condition?
No, I take for this condition alpha blocker. Drug called Tamsuline.
Okay. Don't have any allergy for any drugs?
No, I'm allergic to seafood.
Seafood. Okay. Are you smoker?
Yes, I smoke 5 cigarettes for the last 50 years.
Okay. Are you alcoholic?
You mean I drink alcohol?
Yes.
Alcoholic is a strange word, so I drink alcohol, yes, occasionally in the weekend.
Okay.
Yes.
What is your occupation?
No, I am a retired teacher.
Okay. With whom you are living?
I live with my wife.
Where are you living?
I live in Bangalore, in the
Do you
countryside.
have any problems upstairs? Upstairs?
No. Bangalore is one floor. Okay, all right. What else?
Okay. Okay. Do you need to add anything or ask about anything?
No, what's your diagnosis, doctor?
He taking alpha blockers for BBH.
What is BBH mean?
It's a benign prostatic hyperplasia.
What is hyperplasia mean?
It's increasing in size and number of the cells of the prostate.
It is size or number or both?
No, it's number actually.
Number only. Hyperplasia is number, hypertrophy in size, although in prostate both can occur. Is precancerous condition, this is can change to cancer or not?
CT scanning?
No, it can change to cancer or not?
In
BBH
some,
can transfer to be tumor or not? Yes or no?
yes.
No, never. Benign prostatic hyperplasia never turn malignant, although the patient can have a cancer, but it is not in the top of hyperplasia.
Okay.
Not related. Hyperplasia is not precancerous. It's not like dysplasia. Dysplasia can, carcinoma in situ can, but hyperplasia not. Okay, so first two questions. You ask the patient where you are live and with whom. Why is it important to ask this?
Because the patient, if living beside factories, some heavy metals may lead to bladder cancer.
No. You ask about where you live. It is not important. You don't ask this. You ask also in the first scenario. Why you ask about backache?
Yes, back pain, because if there is a prostate cancer, it may be metastasis to vertebrae.
All right. Okay. Thank you. We just go to the second candidate, Dr. Shell. We have the same scenario, but in this scenario, is the patient is working in the industry, complain of hematuria, and also admitted yesterday and have a catheter. So it is the same Mr. Muhammad, 75 years old, admitted yesterday for retention, and they have put a catheter. So you can start to ask me.
Okay, hello, I am Dr. Shael, one of the surgical doctor here.
Yes,
how are
hello.
you?
Yes, I'm
Can I-
Mr. Muhammad, I'm 75 years old.
Okay, nice to meet you, Mr. Muhammad. I see from the scenarios that you have been here admitted yesterday, and there were catheter. They put for you a urine catheter.
Yes, the doctor insert a catheter and say I have urine retention.
Okay, are you okay now?
Yes, I'm okay, but there's still the catheter in my urine passage.
Okay, and could you tell me more about this? Why
You
put
can
this?
ask.
Okay.
Yesterday, I watching the TV. I found unable to pass urine, so I called the ambulance and they bring here to the hospital, and the doctor insert the catheter and diagnose as urine retention.
Okay, I'm very sorry for this. And it is the first time you experience something
Yes,
like
first time.
this?
Yes.
Okay. And after they put a catheter, there were urine relief, right?
Yes, of course, come. The urine is come and it is red in color.
Okay, if there's any symptoms other than this one that you
You
complain
mean the
from?
previous symptom? You can ask me about the previous symptom. I tell you.
Yes, yes. If there was a blood in the urine.
Past yes, sometimes I have blood in urine.
Okay, and when this started actually?
1 year, for the last 1 year, I have some urinary problem. You can ask me about my urinary problem.
Okay. How many times you go to bathroom, Mr. Muhammad?
Frequency, I go to 6 times and wake up evening to go to washroom.
Okay, so how many times you do urinate at night?
About 4 times.
Okay, and if there's any difficulty to starting urination?
Yes.
And during urination, if there is any weakness or hesitancy?
Yes.
And after you finish, if there is a urine stain at underwears or something?
Not urine stain. I have some desire to go to washroom again.
Okay, okay. And regarding, you tell me there was a blood in the urine, is that right?
Yes. Yes.
Okay. And can you tell me the color of the blood? The color of the urine?
No, you can ask me more specific about the blood. Like it is initial hematuria or
Yes, I will
end
ask.
of the
I
urination.
will ask
all this.
about the. I will ask about the color and the amount and the timing.
The color is dark, is red in color.
Okay, and the amount if it's.
No, it is not pure blood. Is mixed with urine.
Okay, and if it's at the start of urine or the total or the terminal as when you finish.
Say again.
Is the blood is during the starting only of urination or during
No,
or
it is the end of
total?
urination, not the start of urination.
Okay, and
And it is painless, not painful.
okay. I want to ask you some more question. Is that okay? If
Go
you
on.
take any medication,
Like what?
recent medication like rifampicin or some antibiotic or
No antibiotic. I just take. I go to the doctor 6 months ago, and he described to me tamsuline, which is alpha blocker. But I
okay.
don't continue. I don't take it. I just take it for 1 week
Why you stop this is where there is any
because
problem
it's
from?
called when I wake up suddenly, I have collapsed.
Okay, okay. Okay, and you tell me it is the first time you come here for this urine retention. That's right.
Yes, yes.
Okay. If you have any long-standing disease like diabetes or hypertension?
No,
Okay. You take any medication?
no.
You said okay. You have any allergy against any medication or food?
Allergic to seafood.
Okay. And if there's any one of your family have the same symptoms?
And my father died from heart attack, but not from cancer, not from urinary blockage.
Okay, I'm very sorry for him.
Okay,
Okay.
thank you.
And before you smoke cigarette?
Yeah, I smoked 10 cigarettes for the last 50 years.
What about alcohol? You drink alcohol?
I drink alcohol, yes.
Okay. And regarding you have any bleeding from any other
No, I
type?
think just be concentrated. You know, if you remember Dr. Iman, he asked about 2 questions is important in this scenario. She
If
asked
there's any
about,
back pain? If there's any
yes,
back
I
pain?
have back pain, and the doctor say can be related to my condition, and they say is something in my lumbar vertebrae.
Okay.
What
And
else you need to ask more specific?
if there's unintentional weight loss recently?
I lost about 5 kilos in the last month. Okay, so it is important in this scenario. Of course, you ask about other history, but it is important in this scenario to ask about loss of weight, ask about loss of appetite, ask about vertebrae, pain, and all this. Okay, what's your diagnosis?
My diagnosis is bladder cancer.
Bladder cancer can. Okay, so what is the investigation you will do?
I will do a CT scan I will also
No,
do
start by full blood
urine.
count, start by liver function test first. After that, you can do prostatic specific marker, urine analysis. After that, CT scan. Okay.
Okay.
But if from this history, is more related to urinary bladder or prostate?
It's more related to urinary bladder as
Are you sure? It is more to prostate or urinary bladder. They have urgency, frequency. All this is more with cancer bladder or cancer prostate.
it's maybe due to cancer prostate, as also he was
So what test you need to do to differentiate?
I will do a BSA level in the blood.
Okay, so BSA is very high. So what's your okay? Can be cancer. What other differential diagnosis?
For cancer or for
Can be cancer. Can be cancer prostate. Okay.
yes, it can
All
be.
right.
It can
In
be
general,
maybe
for hematuria, what other differential diagnosis?
for hematuria, maybe bleeding tendency, maybe trauma to maybe UTI, severe UTI, or renal stone.
Okay. If this
Complicated renal
patient have a
stone.
cancer urinary bladder, so why he has a cancer? Because he work in the industry.
So
If
I-
this
so I-
superficial cancer, how to treat him?
could,
Superficial
is
cancer
this
in
what-
urinary bladder. Yes.
I will treat by transurethral resection of this tumor.
Okay. After that, how to give him chemotherapy?
I will give him pre and post-operative chemo, maybe also
What is
radio
the
and
route to give
illumination.
chemotherapy?
Maybe target chemotherapy.
What mean by target chemotherapy?
Injection of the chemotherapy to the bladder.
Not injection, it is an installation. You put it through the catheter. So it is local chemotherapy. In superficial tumor, you can remove the tumor and you can give chemotherapy locally. Local means that through urinary bladder and the catheter and close the catheter. Okay. This is patient have a cancer and most probably prostate, because the prostate can spread to the vertebrae. Cancer urinary bladder not spread to vertebrae, and also loss of weight can occur in both cancer. If the cancer urinary bladder, what type of cancer? What we called it?
There's transitional cell type, the most common, and maybe squamous cell, maybe adenocarcinoma. It is rare. Maybe also.
No, what is the common? Say the common, not say option.
Transitional cell carcinoma.
Are you sure?
Yes, it's the most in the
yes,
bladder.
The most common all over the world is transitional. Yes. All
but
right.
Due to there, if there is due to the dye, maybe it is due to chronic irritation, maybe squamous cell carcinoma.
It is common apart from you are from Egypt. Is the squamous cell carcinoma is common or very rare?
Apart from Egypt is rare, but in Egypt
it's very rare. Usually it's transitional, and nowadays occur in people who work in the industry.
Okay.
Okay. After that, we back to Dr. Iman. By the way, Dr. Iman, when you mention the patient is alcoholic is a bad word. You need to, alcoholic mean like addict. So you need to say, are you drink alcohol? Okay.
Okay.
All right. So I think I share the screen. We have a history taken about depression. Is depression post-operative? And this is patient scenario is just as a patient, 55 years old man, depressed after left hemicolectomy, although it is diverticulitis, waiting for histopathology, but the patient is depressed because he's thinking that he have a tumor, he have a cancer, although he have diverticulitis. So you can start take a history.
Okay. Hello, I'm Dr. Iman. I'm one of the surgical doctor candidate. Could I confirm your name and age, please?
Yes, I am Mr. Muhammad. I am 55 years old, and I admitted here in this hospital, and the doctor did to me removal of the left part of colon, and I have a colostomy for disease called diverticulitis.
I am sorry for hearing that. It must be frustrating, Mr. Muhammad. Okay,
No,
I am. Okay, thank you. I am here to discuss with you about your condition. Is that okay with you?
Okay, no problem.
Okay. Are you recently have any loss of pleasure of life?
I am sad because I am afraid to have a cancer because my father is died from cancer colon many years ago.
I am sorry for that.
Okay.
Do you thinking of harm yourself before?
No, no. Okay.
Okay.
What else?
I don't. Okay. I don't. Okay. Not all items in my mind now.
Okay. So if the patient is in bad mood, so what you need to ask, you can ask about sleep, you can ask about mood,
Okay.
all this.
Appetite. Okay. Okay. Do you have any changes in your appetite?
Yes, I afraid to eat because of the colostomy, and also because I have thinking every time, can I have a cancer? Can I have a cancer? Although the doctors say it is diverticulitis, but I don't know it is a cancer or not.
Okay. Do you
Okay.
have any problem in your sleep?
Some difficulty in sleep or to getting to sleep because of thinking.
Okay. Do you taking any drug for this condition?
No, but the doctor gave me something called serotonin something and something like that.
Okay. Are you admitted to hospital before for this reason? This
No,
condition?
no, it's the first time I admitted to the hospital because of the alter bowel habit, and I have this disease in the left colon.
Okay. Is there any
So you ask
limitation?
about sleep, you ask about mood. After that, you can ask about appetite. You ask about appetite. You can ask about sexual. So any change in libido or sex, no. After that, you can ask about other system.
Okay. Do you have any chest pain?
No chest pain.
Any awareness of your heartbeat?
No,
Any dyspnea or shortness of breathing? Okay.
no,
Any weight loss?
no.
Any fever?
No fever. No, I have fever because of the previous disease before the operation because I have diverticulitis, but now I don't have a fever.
Okay. Any joint pain or muscle pain?
No.
Any constipation or diarrhea?
Apart from in the past, I have alter bowel habit, constipation, and diarrhea.
Okay. Do you taking any drug for any other condition?
No.
Have you any allergy to drugs?
To drugs or food, yes, I'm allergic to seafood.
Okay. Are you having any past medical condition
Like what?
like diabetes, hypertension, or asthma?
Bronchial asthma, no.
Okay. Do you done any previous surgery?
No, it is the first surgery for me, so this is why I am depressed.
Okay. Where are you living?
I'm living with my wife in the nearby house.
Okay. Do you have what is your occupation?
I am a teacher.
Are you smoker?
Yes, I smoke 10 cigarettes per day for the last 20 years.
Are you drinking? Do you drinking alcohol?
Yes, I drink 1 can of alcoholic beer every weekend.
Is there any other person in your family has the same condition?
No, but my father died from heart attack.
Okay, I'm sorry for that.
Okay, sorry for that. Okay.
Okay, Mrs. Do you want to add anything else or ask about anything else?
No, thank you. I just repeat the scenario with you. So apart from introduce yourself and all this, so you need to ask about for how long he depressed. You need to ask about sleep and the mood. So sleep, wake up, all this. You need to ask about appetite and sexual function. After that, you ask about you ever felt like before, any feeling low, any problem in your mental health. You ask about this. You counsel any psychiatry before? No. Admitted to hospital before for mental health? You ask about this? No. So this is after that you go to the other system like respiratory, cardio, urinary, rheumatic, all this. After that you ask about medical history, chronic disease, drug history, family history, social history. So what is your advice to the patient? What your diagnosis? What after baseline investigation everything is okay? What's your diagnosis?
It's a depression of the patient due to a surgery and it's a condition cancer.
So if you need, of course, the patient has diverticulitis. So it is serious disease or can be cancer or what you tell the patient?
I will tell her about her conditions that it's just a diverticulitis, that is an inflammation in her
So
bowel.
the patient afraid from this. So this condition can cause this.
No,
Okay, so it is not a cancer, so you need to confirm with the patient it is not a cancer. Sometimes we give selective serotonin reuptake inhibitor or SSR inhibitor, so can be given to the patient. Okay, so apart from the scenario, whatever the scenario, difficult or easy, the easy way to go to through it is just take a history, other part of history of other system or complaint of other system, social history, allergy, family history, all this. The history is atypical. The history, whatever, is okay. Dr. Iman, although you are hesitated, but you're still okay. But it is important.
I wanted to ask some notes. I have some question regarding this station, doctor. If the patient
Yes.
is admitted in the hospital, is it important to ask about his past history or his medical history or something? It should be.
Okay, I tell you, history is history. History is history, and this is history in exam. So history, if you in the checklist of history is a fixed checklist, like history of present complaint, history of present illness, other system, social history, family history, allergy, past history of admission, summarize at the end and start to ask for investigation.
So if there is a station of depression, I will ask also about family history, about this, about family history, and also about smoking and his medical history and other system. Is that
Of
important
course,
to ask
if you
about?
don't ask, this is the main cause of failure. Usually in this station, history stations, usually the student fail because it's not complete the item of history. Checklist of history is not tolerate. In Egypt, you have what's called impression that we have. This is history for depression. This is history for thyroid. This is history for gallbladder. And you have what we call the sheet for history. And this is like in medical school. This is not in the true life. In the real life, history is one item.
I know the question of Dr. Mohammed Al-Shayal. His question is, in Egypt, we don't touch any psychological complaint of the patient. If you are depressed, either stay depressed, and that's the way it is, or consult a psychiatrist from your side, but the hospital doesn't do that. The problem is, Dr. Muhammad, if you are on call in a hospital and you don't have an on-call psychiatrist, then one of your duties is to check the patient's psychological status. And if you feel that he has attempt of suicide, you do what is called, you section the patient. So you inform the authority that he needs to be transferred urgently because he has a suicide attempt. For Egyptian, they don't know this because this is a current practice in United Kingdom. So although this patient is admitted to hospital, so someone takes the history, but again, a nurse might call you, patient with right hemicolectomy in the ward, Harvard, bed number 5, he's depressed, I need you to see him. This is where this station come from. So it's a common practice, if you want to practice in UK, to ask these questions about the psychiatry history. Is it manic depressive disorder? When it start? Which drug he has it? And then you act accordingly. And this is the importance of this question. Did I answer you, Dr. Muhammad?
Okay, I think Dr. Iman raised her hand. What you need to ask
Okay,
about?
speak, Iman.
Doctor, what do you mean by focused history?
Focus history is you need what we do. It is a focus history. You have.
That's a good question.
I will send you 2 books. One is called the Focal History for MRCS, and one is OSCE for MRCS. It is the same. What we do now is the full focus history,
which is a history.
It must
yes.
be complete history.
Yes, exactly.
I think also Doctor someone raised his hand. Who's that? Corollos or who?
Yes.
No.
Good evening, doctor.
Yes.
Can I practice this station?
Yes. Okay. So before Corollos start, I just need to confirm again. Taking a history, have an item. Checklist of the history is not different from station to the station. The item is the same, like complaint, analysis of the complaint, analysis of the pain, history of present illness, other system like heart, chest, urinary, gallbladder, whatever the case, other system, social history, allergy, family history, past history. Each one have one mark. Whatever the history, we don't tolerate it according to what we have. All right, it's very important. And second, don't put in your mind, like last time, this is a case of shorting of breath due to anxiety. This is something. Usually, it is just a history because we know that, you know, the whole history you have in the college, so we just change. I will start with Corollos again, knee pain. So I am Mr. Muhammad, 45 years old. No, Sarah, 45 years old, attend on orthopedic outpatient clinic, history of 2-year pain in the right knee, and she use walking stick. You can start.
Hello, I am Dr. Kronos, one of surgical team. Can I confirm your name and age, please?
Yeah, I am Sarah, and I am 45 years old, and I have pain in my right knee since the last two years.
Okay, I'm so sorry, Miss Sarah. Can I call you Sarah?
Can, no problem.
Okay, can I ask you some question about this?
Okay, can. No problem.
When did it start? This pain? When did it
2
start?
years ago.
Okay, I'm so sorry for this. Do you need analgesia?
No need to do this question, doctor. It is with silly in exam. You look like make a movie. Don't do that.
Okay. I'm sorry. Okay. Did it start gradually or suddenly?
No, it is starting gradually. I have pain in my right knee.
Okay. Is it increasing or decreasing? The pain is increasing?
It is gradual increasing, and you need to ask about character of pain. So it is like souring the pain.
Okay, I'm sorry for this. Is this pain radiating or moving to anywhere?
Yeah, radiated to my right hip.
Okay. Is this pain? Can you score this pain from 1 to 10?
It is. I think it is a 5 out of 10. We have a scoring from 0 to 10.
Is it make you prevent you from making your daily activity?
No, but I use a stick. You see now I have this stick, walking stick.
Okay, I'm sorry. Now, is your leg giving away?
Yes, it gives away sometimes during walking.
You experience any looking while you walking?
No looking, no deformity. What else you need to ask?
You have swelling?
No swelling, but just knee swelling.
Knee swelling only. Okay. Do you have any? Do you have any trauma recently or?
No trauma.
No trauma. Do you have stiffness in the knee joint, especially in morning?
Yes, sometimes I have stiffness.
Okay. Do you feel any? Do you experience any like red eye or itching in skin or any?
I have. You mean other disease? I don't have red eye, but I have Crohn's disease. I take a medication for it for a long time.
I'm sorry for this. Okay. Sarah, do you have any chronic disease?
Is there any relation between this joint pain and my Crohn's disease?
Yes, we will see. We will investigate more. And
all right, okay. All right. No eye manifestation. What else you need to ask?
Do you have any chronic disease like diabetes or hypertension?
No, only Crohn's disease.
Do you have any experience, any surgical procedure or instrumentation before this?
No. The doctor asked me to have arthroscope, maybe done after 1 week or 2 weeks for my knee.
Okay. Okay. Sarah, do you have any? Do you smoke cigarettes?
Yeah. I smoke 10 cigarettes per day for the last 20 years. I drink alcohol occasionally in the weekend.
Okay. Do you experience any tremors or headache?
No headache, no tremor.
Do you feel any chest pain or any shortness of breath?
No.
any constipation or diarrhea?
I have diarrhea because I have Crohn's disease, so I have frequent diarrhea due to Crohn's disease.
Okay. Do you have any difficulty in urination or in
Urine, no. Defecation, no.
any muscle pain except the knee, of course?
No, I have some muscle pain related to the knee. Is like pain in the muscle because of the limited movement and also little limping.
Okay, I'm sorry for this. Okay, Sarah, do you have any question?
No. What investigation you ask for this patient?
I will ask for weight-bearing knee, anterior, posterior, and lateral view. I will arthroscopy. Maybe it will help. And
Okay, can. Okay, but it is important to start by full blood count and all this.
Yes,
Okay,
for
any
blood,
investigation you start full blood count, C-reactive protein, and MRI or arthroscope. I prefer arthroscope. What's your diagnosis?
my diagnosis, it's partial tear of meniscus. Sorry, no, not partial.
Anterior cruciate, because this is give way anterior, so it is anterior, one of the cruciate ligament. Can be anterior, can be posterior. This depends. Okay. So what is your advice for treatment?
I will start with conservative treatment with
Like what?
weight application and physiotherapy and exercise and weight decrease weight, and after this, if not non-steroidal and non-steroidal anti-inflammatory drugs, if not effective, I will start with arthroscopy, total knee replacement or partial.
No, just one by one. So arthroscopy that first is okay. Not so more option. Arthroscope, okay. So what is the relation between Crohn's disease? You ask about eye, you ask about joint pain. So what is the relation?
Extra-intestinal manifestation.
What is the extra-intestinal manifestation?
Sometimes Crohn's disease make muscle pain and
what is the effect in the eye?
uveitis, iritis, and some intestine constipation or diarrhea.
Okay, so can be extra-intestinal manifestation. All right.
Yes, can.
So this is very, very important. Okay. So again, I just to show you something is not. It is important to know that whatever the history, whatever the scenario, we don't. It is must be complete history, complete scenario. Okay. I just to show you the paper I finish. In practice, in Southeast Asia and in England, we don't ask ICE. ICE, I share you the paper of ICE, what is idea, concern, and expectation. We don't like to do that. Okay, I don't know what is in your country, but I speak in just for Southeast Asia, for England. We don't ask the patient what you expected from us to do, what is your concern. It is done in some station if breaking bad news or communication about medication, but not in the normal history taken in traditional book. Emmanuel,
this is very important. Yeah, this is very important advice from Professor Shireen, because when you do the ICE, most lay examiner will fail you, because no one at the end of consultation with the doctor, you ask the patient, what do you expect from me? It looks crazy. I have never, you can say, Professor Shireen, because
no,
I have
actually, Southeast Asia and Malaysia, if anyone attend the exam in Malaysia, we tell the actor, if you say that to the actor shouting you, so what I expected from to do, you are the doctor, you know the disease. I am not a doctor. I am a teacher. So why you ask me that? But maybe in other countries, the examiner, what's called simulated patient may be kind, but our simulated patient is professional.
And
Carlos, you raise your hand. You ask about something?
No, I want to thank you, Dr. Shireen and Dr. Muhammad, because Yes, because this is not
Yeah,
clear
yeah,
before
yeah.
this.
I remember
Okay.
whenever the
No
candidate.
research about it because it
No,
is
no,
common.
this is wrong.
Dr.
This
Shan,
is
what you
wrong.
need to tell us?
Yes, it was done by some courses of some person who told them at the end of the station, tell the patient what do you expect from me, which will make the patient, what do you mean expect? You are the doctor. I am a teacher. I expect for you to treat me. I expect from you to get me well. So please don't do this. We know the source where it came from, but it is wrong. And the people who do it, we just know where he has taken courses in. Is
It
that right,
can done in
Professor Shireen?
some breaking bad news or some like prescribe a drug. And for
Yes.
example, if you prescribe a drug, because this is patient, if you see,
Yeah.
I share it again, it is about drug. So if
Yes.
you, for example, you describe a drug, so you need to tell the patient you take antihypertension forever. So the patient
Yes.
become in panic. How I take medication forever? I just
Forever.
need
Yes.
1 week.
Yes.
So the usually
No.
is impact in
Yeah.
some medication, in some drugs can.
Exactly.
You just expect to the patient, I give
Yeah.
you Coversil forever. And why you give it forever? Maybe in panic. Dr.
Exactly.
Iman, you raised your hand. Do you need to tell something?
No,
Or
they
you
raised
raised it
their hand
before?
as clapping to your effort.
No.
Yes, I wanted to know what difficulties in my presentation, what
Actually, I tell you, but it is important also, even for Dr. Muhammad, we don't know what is your performance even when I am the examiner, because what we have at the end, we make a curve.
Yes.
So sometimes in some station, the station is out of 20. So sometimes your performance is not good. But Corollos also in the same station is not good. And the Dr. Shell in the same station is not good. So we make the bus mark for this station 7 out of 20. And in some station, the bus mark may be 17 out of 20. So we don't know what is your performance. But
Yeah.
it is 18 station, 17 station now. So the 17 station, the important for exam, it is just don't be exhausted. If you look exhausted at the end of the middle of the exam, it gives you bad impression. Okay.
Yeah, but I know Professor Shireen is speaking from a statistical point of view because the Royal College, whatever you do, they have a fixed passing rate. But what I wish from this course to help you is to make number one pass. So you will get not a fail, not a borderline. This is number one. Number two, you hit for 18 to 20 grades. So you take from 18 to 20. So most answer, you're professional, you're quick, you got it right. This is what we aim for you. If you hit the borderline, so some of this, some of that, you are risking your situation. And it's a lot of money. It's now 1,100 British pound, which is too much for Egyptian doctor. So you have one chance to pass it, prepare well, listen to all this Viva courses, and hopefully we'll do a handout at end of September. Attend the handout, prepare your question. You should get in most station pass and more than 18 degrees. This time you have no worry about statistics or curve because you are on the safe side. But what Professor Shireen is speaking about, if you're borderline or not sure if you're going to pass or not, it needs to be collected by computer, analyzed, and then graded. That is why you wait for 1 month before you get your result by email. In the old days, when me and Professor Shireen were examining, we get the result on the same day. That's what the FRCS. You remember?
Yes, yes, and even MRCS in the past to make the result, but now we make a comparison, and again the comparison is not in the same day with the
Yes.
same student from the same country.
Yes.
It is comparison between other countries.
Yes. Yeah.
Okay, just to know that it is important.
But you are doing well, Dr. Iman, Dr. Corollos, Dr. Mohammed Al-Shayal. I've noticed your improvement, how you introduce yourself, make sure whom you are speaking to. Empathy have improved a lot in this course. I noticed a lot of empathy because a lot of Egyptian, my father have died yesterday. Okay, So blah blah blah, and this is the commonest response. But Dr. Iman, in the depression station, which is a common mistake to all Egyptians, because you don't deal with depression, post-operative depression or postpartum depression, but this is common request by nurses to come and assess. Do you need an on-call psychologist? You need transfer to another unit, or it is just a simple medication? So this is why this station is important. But you are doing well. Please ask your question on the chat room. It's about to end, so I will leave it to Professor Shireen. We got just 1 minute.
No, I just put the focal history examination and the OSCE stations checklist. I think we can put it in the Telegram group.
Excellent.
So
Excellent. He asked me about it. Yes. Excellent, Professor Shireen.